Well, good evening, everyone, and welcome to Straight Talk for tonight's online community forum. I'm Pam Duncan. I'm the CEO of Metropolitan Development Council. And as always, I am joined by Amanda Westbrook, who serves as the moderator slash facilitator for tonight's discussion. Amanda.
Thank you, Pam. Tonight's discussion is the 40th, 40, in a series of discussions started last year. We hold weekly discussions around important topics impacting the community in Tacoma and Pierce County. Ms. Pam?
Tonight, we will talk about the importance of kidney health and to recognize that March is National Kidney Month. And the most important message throughout the series of conversations is that there is hope for our community. Amanda.
Pam and our audience and our esteemed panel and Mr. Rob, we'd like to take a moment to acknowledge that this meeting is being conducted on Indigenous lands of the Puyallup people. We gratefully acknowledge that we rest on the traditional lands of the Puyallup people, where they make their home and speak the Lushootseed language. Throughout tonight's conversation, you can submit questions to be addressed by our speakers using our Q&A function in Zoom. We cannot promise that we'll have time to consider every question, but we'll make our best effort to get through the list. And now I'd like to introduce our guests for tonight's discussion. Dr. Osama Amro works with patients who have kidney issues at Swedish Hospital and is affiliated with the National Kidney Foundation. Welcome, Dr. Amro.
Thanks.
LaMont Williams is the recipient of a kidney transplant. Actually, he's going on his second one right now, and has some deep personal insights into the issues related to kidney health. LaMont, thank you so much for being here and bringing your story.
You're welcome. I'm honored to be here.
All right, Ms. Pam?
Yeah, and before we start tonight's conversation, we want to take a few moments to lift up those in our Asian American and Pacific Islander communities across Tacoma, across Pierce County, and across the nation in the wake of the racist attacks that killed 8 people in the Atlanta area last week. 6 of those who died in the attacks were women from the Asian American and Pacific Islander community. We are concerned with the continued rise in hateful attacks against those who are in the AAPI community, and we do not condone them. We urge everyone to be supportive, to recognize the impact of these attacks across the country and how those attacks are impacting those in our own community, and that we all intentionally create a safe and supportive space for those most deeply impacted. And so if we could have a moment of silence, please. Thank you.
Thank you, Pam, for that. So we're going to get started like we do every week with a check-in of how everyone is doing in their heart tonight. How are you doing, and or what feelings are you currently processing? And I'm going to ask this of all 4 of you, and all 4 of you or one of you or any of you can jump in at any time as the Spirit moves you.
I can start.
Thank you.
I feel optimistic. Having gone through the pandemic, the year that we a very difficult year for all of us. I remember being in April, seeing patients very sick, losing patients. And in fact, one of my first patient I lost is a recipient of a kidney transplant. So these was very difficult times. And I do see a light at the end of the tunnel. And that's feeling of optimism. It just really what gives me energy. And I feel that, we really went through a tremendous difficulty, but I am optimistic.
And that is the best medicine.
I was thinking about what Dr. Amro just said, and I'm so sorry you lost that patient, Dr. Amro. As a kidney transplant recipient, I was very cautious. And so in a sense, that validated my cautiousness. But I've also received the first round of a vaccine. So I too feel optimistic that as the world is educated regarding the prescription for creating the herd immunity, and I want to make sure I get those terminologies correct, that we're seeing a reduction somewhat in all of these different cases. So I'm optimistic as well that at some point my daughter, who's a junior in high school, can go back to school and try and regain some degree of normality.
Great.
So I have mixed feelings. I'm so excited about this particular conversation that we are having. I think that I recognize how critical it is that we lift up the importance of kidney health. People don't necessarily realize or understand how important your kidneys are to your life. And so I'm really excited about the conversation. And at the same time, I am I'm yet again appalled at the situation that we are seeing in our community, in our nation, and that we are saying again. So we have a lot of work to do on the social justice front, that we are moving through the pandemic today. We have officially moved into phase 3, and we need to have phases, identify phases for racial equity and social justice as well.
Brilliantly said, Pam. Thank you. And Rob Huff, who is our technical director and also is the director of advocacy and communications for MDC, and also writes beautiful questions for us every week. Rob, how are you checking in?
Oh, I am feeling a mix of emotions as well. I do feel a little bit of optimism. We are coming into spring. It's always easy to be optimistic when you see flowers coming up and birds starting to return to the area. But I also feel this trepidation and a little bit of concern. My kids are going back to school, 2 juniors, stepdaughter in the home who goes back to school actually tomorrow. And then our foreign exchange student from Germany who started tennis at high school today, which actually was her first real American high school experience. So, I'm hoping that the precautions that are being taken will keep the kids safe as they go back to school, and that our community continues to heal.
Well said, Rob. Thank you so much for that. I want to address the first question to Dr. Amro. And the question is, what are some of the common conditions that lead a patient to you?
Again, thank you for inviting me today. I'm happy to answer this question. Really, as a kidney specialist, 90% of our patients come with already established diagnosis of kidney disease. So they already have the diagnosis of kidney disease, and we're trying to look at the root causes of what caused the kidney disease. And 90% of our patients, and that applies to nationwide, have a kidney disease related to diabetes, high blood pressure, and recently obesity. And we like to tackle kidney disease in different aspects. First, a prevention part, and then early detection. So education related to the community and education related to the physicians to early detect the kidney disease. But to answer your questions, really the most common etiology for kidney disease is high blood pressure, diabetes, and overweight. A lot of other causes not related to these diseases, but such as autoimmune disease that can happen without apparent reason, or a drug reaction, like allergic reaction to drug cause the kidney disease, or overuse of a pain medication, which is really an underestimation, undervalued, and we tend to pop a lot of pills every day for muscle pain, for backache. We don't realize that in the long term this can have serious consequences in the kidney disease. So I think, and the kidney health overall. So these are the most common scenarios and etiologies why we see patients in the kidney clinic.
So Dr. Amro, I'm looking at diabetes, high blood pressure, obesity, and then I put in this big square pain medicine overdose, because we hear all the time about opiates and people overdosing on pain medicine, and yet somehow it seems to fall below those top three that you just put in there. And I have to also say that I would be remiss if I didn't look at that and go, and all of those are preventable before people come to see you, if they are aware of those issues, hereditariness, and of course, what they are born with in terms of their DNA. So how common are issues with kidney diseases in America, first off? And is it an issue that's been increasing in the recent years?
Yeah, this is a very important question. I think it is sad to say that this is a common disease. Based on the CDC, up to 37 million people in the United States have chronic kidney disease. And the sad part is up to 40% of these patients are not aware that they have kidney disease. So because kidney disease is a silent disease until it reaches an advanced stage. Think of this, the high blood pressure is a silent disease. So the patients can run with a high blood pressure without knowing. If you don't measure it, you don't know that you have high blood pressure. Same thing with the kidney disease. A lot of early manifestation of the disease is completely silent. So without early checking, without early detection, a lot of people will be, moving around without knowing that they have kidney disease. And the sad part that this is increasing because the numbers of patients with diabetes is increasing. The number of patients with high blood pressure is increasing. Overweight has becoming a problem, including our children, including multiple aspects. And the pandemic, if anything, got things worse because unfortunately, a lot of us resort to comfort eating. A lot of us had even the activities that we used to do, has become very limited. So I really think it's a new way we have to look at how can we maintain our health before we get sick. So I think this is really an important way of thinking moving forward.
Thank you for that. And I've also loved watching Lamont's face as you talk. I saw some big ahas go across the face and some big, yes, you're speaking my language. So question, I'm going to start with Lamont first, and then we'll go to you, Dr. Amro. What are some of the main things, Lamont, that people can do in terms of avoid developing kidney issues based upon your experience?
Well, that's a great question, Amanda. And as Dr. Amro was speaking, I was nodding my head because my kidney disease was detected because I was going to the doctor for a totally unrelated event. Because diabetes runs on my maternal side of the family, my maternal grandfather always said to me, stay in touch with it, always get checked out. And so I made a promise to myself that when I became of age, had my own health insurance, I would go to the doctor every 6 months and get blood work. Well, it was around the spring of 1999, and my internal doctor said, no, you're still not a diabetic, but I see some other things that are basically beyond the scope of what I can do, and I have to send it off to the lab. And sure enough, the lab came back and said, we think he may have kidney disease. And I was shaking my head because Dr. Amro was right. I was just telling somebody the other day, there are no telltale signs. It's not like you become jaundiced. It's not like, something grows, there's a growth. It's not like there's an abnormality in your breathing rhythms. It's just you're living And one day you go to the doctor, for some people too late, but for me, I would say prevention. And I would really stress to my brothers and sisters out there to keep going to the doctor. Thank God for access to healthcare, because of course we know kidney disease disproportionately impacts my community, communities of color, more than anyone else in the world.
So, and I want, my next question is I want you to share your experience as a two-time kidney transplant. But before we do that, Dr. Amro, based upon what LaMont said, and what I took from that when you said you had no symptoms, I mean, you were in there for something else. And often we hear that if people are having regular checkups, those checkups can save their lives. Is that correct, Dr. Amro?
That's true. I think early detection in a lot of the diseases is really a life-changing for patients. And not only that, a lot of patients, have, some motivation to change their diet, some motivation to change their exercise. But once they hear that they have early sign of kidney disease, this is really a point in which they change their lifestyle, they change their diet, and that can be important for their lifestyle and important for their disease projection. So that would be a changing point for them and turn an early kidney disease to resolution of the kidney disease. Also for disease that, not related to lifestyle, that autoimmune disease, early detection really save tissue. Time is tissue. So kidney tissue. So if you're able to detect a kidney disease early on, get the appropriate treatment, and instead of finding this with a total kidney failure, you'll be able to save the kidney. So you'll be able to live completely normal life with early detection. So absolutely early detection is key. Now, there are things that makes you more prone to kidney disease, as Mr. Williams said, that he is at risk of diabetes. So that prompted him to get early detection. So I would say for anybody who have a family history of diabetes, or anybody who have a family history of kidney disease, or anybody who have a family history of high blood pressure, please do routine testing. That's, if everybody has to do it, 10 times more applicable to you to do that if you have underlying condition.
So, Dr. Amro, two questions before I ask LaMont to share his journey and his wisdom with us. Number one, let's talk about the effects of alcohol and drug on kidneys. Or if you are like myself, I have a history of diabetes and alcoholism in my family. That's my first question. How does that affect that? And then secondly, with early detection, can kidney disease be reversed?
So we'll start with the easier question. How about that? So we start with the question of early reverse. So a lot of the disease can be reversed if detected early. For example, if the disease is related to pain medication, early discontinuation of the pain medication will reverse the disease. If the kidney disease is related to diabetes, early and aggressive treatment to diabetes can slow the disease or reverse some of the damage. So absolutely, you're correct that early detection is the key. Now, to answer your first part, I think this is more complex, but I'm going to give you a fact, a clinical fact, that 25% of the blood that's pumped from the heart every single minute goes directly to the kidney. So think of that. The kidney receives 25% of every single heart pump. So the kidney is very sensitive to your overall health. If you are healthy, you're likely your kidney will be healthy. If you're not healthy, your kidney will likely not be healthy. Even if it's healthy now, in the future will not be healthy. So excessive alcohol is not good. Illicit drug use is not good. Excessive pain medication is not good. Overweight is not good. So sedentary lifestyle is not good. Think of this. Your kidney is so sensitive because this is a very vital organ from your body. And every single heartbeat, 25% of the blood goes to the kidney. That means the kidney is one of the most sensitive organs to your overall health. So if you want to remember something from today, that, the healthier you are, the healthier your kidney is.
Dr. Amro, if you have an unhealthy kidney and you don't know it, does that mean that more than 25% could be going because the kidney's needing more vitamins, blood, minerals, because it knows it's not doing well?
So you are referring to the concept of hyperfiltration. Yes, for example, the kidney might be under stress and you're having excessive filtration. Still, the numbers looking good, but the kidney under stress because the kidney is working very hard to maintain the normal numbers. So even with the normal numbers, the kidney can be under stress. And always remember, the healthier you are, the less likely the kidney will be diseased. And one more thing, you mentioned something very important. You said, don't stress your kidney. So the fact that you're able to handle 10 grams of salt a day, that's not a healthy thing. Although you are able to handle this, but it comes with an expense in the long term. And the fact you did not get sick with 7 drinks of alcohol a day, does not mean that after 5 years or 4 years, the kidney will be able to handle this. So don't stress the kidney as much as you can.
Very wise words about sodium and everything else. LaMont, can you share your experience as the recipient of a kidney transplant? And I would love to hear just when you were first diagnosed, because you mentioned you had gone there by accident, and then the whole journey leading up to today.
Okay, I'll try to put it in a nutshell as best I can.
Time.
I'm going to speak in generalities in terms of seasons. Spring of '99, that's when I went to my internal doctor. He's like, hey, everything looks okay. You don't have diabetes, but, I already mentioned about that. He sends me to a doctor who does a biopsy on my kidney. That biopsy comes back. They said he has kidney disease. To be very frank with you, I was in disbelief. So I went to a second nephrologist, totally separate HMO. I went to a totally separate health system. Not only did that nephrologist say I have kidney disease, but you also he mentioned something else. And I was like, wow, he's even more detailed. So I stuck with that nephrologist. I asked him a question that, of course, he couldn't answer, but I'm trying to get answers like, how much time do I have? Where am I at? On a scale of 1 to 100%, where am I at? He said, we really can't answer that. You could need a transplant in 10 years, 5 years, 2 years. We really don't know. But what we're going to do is start this regimen. My actual disease is very, very rare for a man of color. It's called Iga Nephropathy. They don't know how I got it. And so we kind of had to go through, I'm sure Dr. Amro is familiar with that disease. So what happened? Being diagnosed with the disease didn't so much bother me per se. I was not obese. I didn't have high blood pressure. I was not a diabetic. I'm very young at the time. So I'm like, hey, we'll beat this. What really made me cry like a baby was my first day on dialysis about 2 years later. I'm at home. My stomach is in excruciating pain. And I just thought, I don't know. I'm just having gastrointestinal issues. I'll be okay. So I'm doing the Pepto-Bismol, blah, 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 blah. About 5 days later, I'm like, you know what? Something's not quite right. I go to my nephrologist. They do blood work. He calls me the same evening. That's when I knew, okay, he said to me, your kidney output is at 8%. We need you to be at the hospital early tomorrow morning because we're going to put a catheter in your chest.
Wow.
Exactly. That's when I was like, oh, it just got real. I get there, they put a catheter in my chest. I'm on dialysis the same day. So there's a chest catheter for someone who's not prepared, okay? That's my first time around. If you don't mind, I'm going to skip to my second time around. My second time around, we're prepared because I have a transplant. I'm seeing a nephrologist like clockwork, like I should, okay? Wait, let me back up just one moment. My first day on dialysis with my fistula is when I cried like a baby. The gentleman on my right did not have any extremities whatsoever. He had no legs. Okay. The gentleman on my left, excuse my language, he looked as old as who knows who. I was easily the youngest person in there by 30 years. I know I was. I cried like a baby and I asked the nurse, before you hook me up to this machine, if I'm going to lose limbs, I'm not doing this. She said, Mr. Williams, I can't really get into their situation, but these gentlemen have not done what they're supposed to do. This gentleman had legs. That's what she said a little while ago, but due to diabetes and not really taking care of himself, they began to, take care of his limbs. I was like, okay, well, I have a shot, So that was very, very difficult. Being on dialysis, I went from working full time to not working at all in a matter of 3 months. Now, it's going to hit everybody different. So I don't want to give a lot of timelines because some people who are watching, they're going to take that as gospel and they're going to be like, well, he said, so it's going to hit everyone differently. Now I'm going to go to my second experience because you asked me, how was it? Well, after my first experience, I educated myself. I didn't just go to the internet and get on a search engine. I actually spoke to my doctors in depth. I asked like 200 questions. Is it genetic? Is it this? How do we beat it? How do I do that? And they would give me all these different treatments. I did everything they told me to do. And I said to my doctor, I want to make this clear to you, doctor. I want to live. So whatever you tell me to do, I'm going to do it. Now you have to understand, Amanda and Rob and Pamela, Dr. Amro knows this. Then there are side effects for every medication that you take. So as you begin to introduce these different medicines into your body, there are side effects, and so I was in a heavy depression. I'm young. I have no children at the time, married to my beautiful wife. And I had another bout where I just cried like a baby. And because I thought if I were to die tomorrow, no one's going to remember me. I'm young, And so I started going to therapy to see a therapist. And I want to say that to anybody watching, you have to go. You really have to go because you can beat this thing. So Amanda, where do you want me to go next with my timeline?
Well, so, gosh, my brain is just spinning, and I can look in Pam and Rob's eyes, and they're doing the same thing. I want to go back just for a second about the depression you experienced. Can you share with our audience why you chose to tell us that and what role depression plays on physical health?
I chose to tell you that because obviously a lot of Black men, we just are made to feel by society that we are super, super, super tough. And in many instances, our institutions of religion, our educational systems, they don't encourage us to seek treatment. While men experience depression just like women, we're more likely not to go. So you have to remember, because I am a man of faith, my church at the time did not necessarily speak about medicine and it's okay. It was the traditional taboo per se. And so what did LaMont have to do? Amanda, I had to live for myself. And so I had to have a moment where I read in the Bible where there was a woman with an issue of blood. She didn't go directly to Jesus. The Bible says she went to all of these other doctors and grew worse. Then she went to Jesus and gets the miracle. What was the moral of the story for me? Go to the doctor first. Then ask God for a miracle. Parallel to me, which was a blessing for me, there was a gentleman in my church who needed a liver transplant. I'm not going to mention his name. I just want to say he chose a different route and he expired. The route that he chose wasn't so much to educate himself, wasn't to go get medicine. He was just like, I think I'm going to be all right. And so I knew then I can't afford that route. Why did I get depressed? Because I'm so young. I had no signs. Dr. Amro said it's silent. One day you're playing basketball, you're doing all of these great things, and then they say, oh, you might have this, it might have, and then a few years later, you're on a machine and your arm, that used to be, I'm going to show you a little bit of my fistula, your arm that used to be smooth. And I used to kid my wife and say I was once a forearm model, but I can't be a forearm model anymore. Because let me get this shirt up. I don't know if you can see that raised thing on my arm. That's my fistula. And that's where they stick the needles in. And Dr. Amro, I put myself on the machine. There's a thing called being infiltrated, is when the needles are put in and they're not put in actually correctly. And it's just a whole thing. And why did I mention depression? Because it's real. And I'm not a pessimist, but if you're diagnosed with a disease and no one really knows how to help you, the general public still doesn't know a lot about kidney disease. That's why I'm so glad we're doing this. If you tell someone you have other types of maladies, they're like, okay, well, let's get you some help. No one in my family knew what to do. No one really knew how to help me. No one knew what to say to me, especially in my religious, situation. No one really knew how to address that. And so it was a whole lot of, we're not sure what to do. My countenance changed. I'm a very fair complected young man. Due to the toxins in my body, my complexion went darker by 3 or 4 shades because I was put on a certain drug. I gained 60 pounds. It was atrocious. And when I stepped on the scale and I weighed X amount, I cried again. And I literally said to my doctor, everything you're trying to do to keep me alive, I feel like I'm dying right before your very eyes.
And you were not working. So we can add one more tick to the box that makes you feel like I'm not me.
Yeah. And what man doesn't want to work? What human being? I don't mean to, disregard the ladies who are watching this, but as a young man, that's what I'm taught. I've been working since I was 14 years old. So to lose my employment, I lost a lot of my identity. When men meet each other, normally it's not what's your name. It's like, well, what do you do? It's not how many kids you have. It's not where you're from. It's like, what do you do for a living? So going to meet new people, I no longer had that as part of my narrative. And yes, that really added a whole nother layer to my depression.
Yeah. LaMont, before I ask Dr. Amro about the challenges of finding matching donors for those who need a kidney transplant, how long in your first journey with your kidney disease were you on dialysis before you got that kidney transplant?
Yes. Oh, how long? At least 2 years. But that is not the norm. Okay, I want to caution you again. Because we live in the Pacific Northwest, even though it's a national system, Dr. Amro is definitely well aware more so than I am. I do want to tell you this, Amanda, because it changes the experience. My first kidney transplant was a deceased donor. My second kidney transplant was a living donor.
Oh.
So you have different variables there. You have different ways of kind of going through this. Everyone is going to be put on that national registry. But I was on dialysis for about 2 years that first time, and it was very difficult because I was just simply maintaining.
Yeah. Okay.
Go ahead.
Hold that thought.
Yes, ma'am.
I want you to describe. I love that you called me yes, ma'am. I feel like I'm back living with my grandmother because I called her. Because I want you to talk about the differences of getting that kidney and the actual procedure. Dr. Amro, what are the main challenges for matching donors with those who need a kidney transplant? And what are the challenges nationwide, but also here in the Pacific Northwest?
Okay. Before I answer this, I want to say, Mr. Williams, hats off to you. Hats off to you for your determination. Hats off to you for your strength. You went through a lot. You took this in a positive attitude, and things could have been much worse without this attitude. So again, hats off to you. I think this is really important. And I know that I'm just steering away from your question for a second, but I think Mr. Williams mentioned an important thing, that there are diseases that we don't have treatment for that. There are diseases that we don't have treatment for kidney disease. So that's why we're hoping in the future that even the diseases that we don't have treatment, that we will develop treatment. So a lot of research is ongoing, a lot of donation for a kidney foundation will help, a lot of volunteer to try to find a cure for these diseases will be helpful in the future. As I mentioned earlier, Amanda, that I spent the first 3 years learning how to do dialysis from my fellowship, and I'm hoping to spend my next 30 years of career to learning how not to do dialysis. So going through dialysis is not fun. Going through dialysis is a part-time job. Just doing dialysis is a part-time job. So this is not easy. So back to your question, and that's why if we are unable to treat the disease, if we are unable to prevent the kidney disease, if we end up with the most feared complication of kidney disease, which is kidney failure, what can we do? And you ask a question about what's the issue with kidney donation. The biggest problem, simply put, that we don't have enough organs. There are too many patients with kidney disease, and simply there are too little donors who have donated kidneys. And there are multiple barriers, but I'm going to dwell into 2 barriers. First barrier is education. So thank you for doing, you and the team, Pamela and Amanda and Rob, thanks for doing similar program, because that will educate the public. So the education barrier is people don't know that they can live completely normal life if they donate their kidney. They actually don't know. They said a lot of donors will come and ask me what will happen to me? When will the other kidney will fail? Can I have children? I can't tell you how many times I get questions from ladies said, can I have children after I donate the kidney? So there is a barrier that we need to break. And this is a knowledge barrier that, healthy individuals can donate a kidney to their loved ones and they live completely normal life. And trust me, with every healthcare system, we look after the donor even more than we look after the recipient, because we want to make sure absolutely that they live a normal life. So we go through rigorous testing before we approve the donor. So the donor get checking for any disease. We check the kidneys, we check the arteries going to the kidneys, we check for any hidden disease. When we are absolutely certain that this donor is healthy and they're going to live completely normal life after donation, we will approve them for donation. Not only that, we will make sure that we provide them with support, psychological support, that, emotional support. And nowadays, a lot of insurance will pay some of their travel, some of the lodging to donate for the kidney, their loved one. So I think the barrier of education is really important. Having more donors will definitely change the trajectory of our system. Now, Mr. Williams mentioned also deceased donor. So this is also a problem, because a lot of us, how many of us opt out of checking the box in the license being a donor? The majority of us, or the majority of people, will opt out. But when you think deeply about it, when you have loved one who has a kidney disease, you can think about it again and say, you know what, it might be something good to donate a kidney if, Lord forbid, I lost my life and I'm the body in a status that can donate a kidney. That might be something good. So education, barrier regarding the education is the main issue. So I think, again, we're really thankful for similar programs, because that will tackle some of the barrier regarding education, whether deceased donor or living donor.
Pam, I want to hear from you on this topic, because I have a sense that you have something to say behind those kind eyes.
Well, yes. I am a kidney donor. We had intended to have a guest donor on the call, and we weren't able to make that happen. And actually, I was not planning to be part of the conversation, but rather to listen. I do think it's very important, though, that people understand that you can continue to live a very normal life, and at the same time, you have helped someone else to live. And everything that Dr. Amro said about the testing and being taken care of as a donor is so very true. I think actually he even understated it, because I was treated like a queen. But
you are a queen. We thank you for what you did.
Thank you. But I do think I am speaking up because I think it's so important for people to know that, first of all, that you can donate a kidney if you are in good health. I did not know at the time that it became, I was made aware that there was someone in my life who needed a kidney. I didn't even know that you could donate. I just knew that you could donate blood, and I regularly donate blood, but I didn't know anything about donating a kidney. So I kind of had to do some research, and then I just felt like this is the thing for me to do. And if I had another spare kidney to donate, I would do it again, because I know how much it meant to the recipient. And so I just feel that it's so important to share that with the community, that people can donate a kidney.
So Pam, I want to walk the line of respecting your privacy and hearing that you were not prepared to come talk about this today. So you can say, Amanda, I'm not going to answer that if you want to, and that's okay. I'm wondering, in order to educate people about donating a kidney, if you will talk about the moment you walked into the doctor's office, and as Dr. Amro said, they began to test your kidney, to all the way when you woke up in the recovery room and you were giving somebody the gift of new life.
Mm-hmm. I can't explain this other than I knew I was supposed to donate the kidney. It's a very, to me, it's a very intriguing process. All of the various ways that you are tested and that you are vetted even before the testing begins. Like you're vetted to make certain that you are not being compelled to donate, that you are not being paid to donate, that you are in your right mind. So you're making a sound decision, that you will have someone to care for you after the surgery. And so that was a little bit of a snafu for me because I wasn't going to tell anyone. And the nurse who was doing the vetting said, you know what, we will stop this process right now. If you don't have anyone, or if you're not going to be forthcoming about who's going to take care of you, because I really want it to be completely confidential, that whole process. And I will say it's also a really enlightening process for your family and your friends, because people were concerned naturally for me. You know, my dad was just like, oh no, I don't want you to do that because he's thinking, you know, I'm gonna die. So I had to do a lot of educating with my parents, my children, my extended family. And overall, I got everyone's blessing. I was wondering, so Dr. Amro said there are women who ask, you know, can I have a baby? And I'm well past that stage, thank you, God. But I was just really wondering, so what happens inside to my insides? Like, is there gonna be this big vacant spot in my abdomen where the kidney was removed, you know, stuff gonna be sloshing around? And no, you know, nature abhors a vacuum, and your body just, that space is just taken up by whatever, your intestines or whatever. But after my surgery, and I think I took a 6 or 8 week period of time off just so I could rest. But really after a week, I felt fine. I was just tired. And then, but no pain for me. There was no pain after about a week. And then I just, you know, made certain that I rested, and I still make certain that I take care of myself.
And Pam, are you still in contact, or were you in contact with the recipient, and how are they doing?
They are doing fine. I was not going to tell the recipient. I was not going to divulge that I was the donor. And what I really appreciate is that the donor team respects your wishes. So it was after some time that I decided I would share with the donor that I had been approved to be, the recipient, that I have been approved to be the donor. And yes, I know that they are doing well.
I'm sitting here in this donor's position and just thinking, the phrase "thank you" does not cover when somebody gives you the gift of their kidney. I mean, this is huge. I didn't even know this about you, Pam. So of course I love you, but now I love you 10 times millions more for what you have done. Dr. Amros, I want to ask this question of how different, or is it different, for those in the Black, Indigenous, and people of color populations to have kidney disease and also to be on a transplant list?
I think this is a very important question. But first, Pamela, thank you for what you did. I think this is really huge. And Amanda, you summarized this absolutely correctly. This is the gift of life. This is the utmost act of altruism. And I hope your story will be inspiring for everybody who's listening to us and for generations to come. Thank you very much. Very good. Back to your question, Amanda. True. Unfortunately, like all our healthcare system is favoring, disfavoring the people of color, people, marginalized communities with language barrier, with financial hardship. And the truth is, you have to dive into the system a little bit to understand. And, being a practitioner for the last 6 years, now I understand what's the problem. When you look at the system will say, Caucasian, and African American have equal match in the system. The system will be matched equally. However, in reality, that does not happen. Why is that? Because a lot of community of color have no access to insurance. So you have a problem with that. A lot of community of color, they don't have, for example, transportation issue. There is a transportation issue to do the testing. So a lot of barrier. And there is also sometimes mistrust to the system, and judgment issue. So a lot of people will say, okay, is the system in paper is equal, but in reality, we have to jump extra hoop. So I always work with my patients, regardless. Elderly individual, they don't have anybody to drive them to the testing. So they end up without testing. So you need the heart to be tested to be sure that the patient can receive a kidney. So if you're unable to go to the testing, you'll not be listed in the kidney transplant. And that's the way in reality, there is a disadvantage. So, and these things can be corrected. And these minor things, I call it minor, but it's extremely important. We need to work, all of us, to help with that. So I always tell my staff, don't settle. Don't tell the patient, go schedule a heart check. Schedule this for them. Schedule this, help them out. Next time I said, what happened to your testing? We will not stop until you get the testing done, because we need to have language barrier is the biggest issue as well. So a lot of patients with language barrier, they will receive a call without an interpretation. They don't know what to do. So you have to go the extra mile to have the system to work equally. The system in paper is equal, in reality is not. So every one of us has a role in making this equal system and having the patients from all backgrounds to get the kidney transplant.
So Dr. Amro, you are almost a diagnostic engineer of institutional racism, in the sense of what has happened here, the barriers for people who want to give a kidney, but also need a kidney. Are you sharing this with your fellow physicians, what you've learned?
Absolutely. This is something I get trainee all the time, fellows, residents, and I always tell them, we have to make sure that the patients are treated equally. The system is full of barriers, and our goal is to break every single barrier. And sometimes the barrier is education, just a simple education. So spending 5 minutes with the nurse, remember the story with Williams talked about the nurse, this 2 minutes that the nurse spent with him about motivation, about, he has a chance in life, made a difference. So I want everybody, to go the extra mile, so everybody has the chance to the gift of living, of life, and being able to get a transplant. And same applies to every aspect of healthcare system. Unfortunately, it's the barriers, it's the barriers that we need to tackle.
Absolutely. And oh my gosh, LaMont, I can't even imagine what you must have thought when you looked to your left and saw the man that had no legs. I mean, you're already terrified. I mean, you found out less than 24 hours ago, you have to come in and get this portal. And now you're looking over here thinking, am I going to lose my legs? If I am, forget it. So thank goodness this nurse saw you as a person. And could see the fear in your eyes, because fear does awful things to our bodies.
Yes, it does.
True.
So what have these transplants meant for you over time?
Oh my goodness. First, I want to go in retrospect, and I'm in complete amalgamation with Dr. Amro with saying that Pamela is a queen.
She is. We all know that.
Yeah, you ought to be queen for a day, a week, a month, something. Thank you. And I want to say to Dr. Amro, thank you. I'm getting a little emotional, but thank you for fighting for people of color, man. We need more advocates like you for my brothers and sisters of color, brown, indigenous, whatever the case may be. Because in fighting for us, you're tearing down the white privilege that exists in the medical industry. We all know about the Tuskegee syphilis that is still impacting our community. I have Black men talking to me right now who's like, I'm not taking, one guy literally said over my dead body. And I'm like, wow, what such a choice of words, because that could possibly happen. And that is still impacting. I mean, how many years later? 50? So education was the thing, but how, Amanda, I can't put it into words, so I'll try to do this as best I can. Number one, quality of life. You want a transplant because it helps your quality of life. But there is more to my story. I don't know how much more time we have. I have what they call now an unremarkable health history, in that getting the workups, Pam talked about that as a donor. Well, the recipient is also getting workups because they want to make sure, as Dr. Amro alluded to so graciously and perfectly, that they want to make sure this is a suitable, donor. So you see every specialist under the sun. Well, by seeing a urologist, they noticed a growth on one of my native kidneys. They took a look at this growth over a space of 6 months. They determined, once I was already on the list to get a transplant, they determined it was cancer of the kidney.
Wow.
So I want you to sit with this for a moment. I'm on dialysis again around 2016. I'm doing at-home dialysis now because you can do that. First time I was in center. Because of being in center, I know about that. So did a lot of education. My wife took a 8-week course with me. I'm doing it in home. So my wife is basically my nurse, which, oh my goodness, hats off to her. They tell me I'm on the list, which is, hey. And then about 2 months later, they're like, we have to take you off the list because we found kidney cancer. So I literally looked at my urologist and started laughing. I said, you have to be joking, right? He's like, no, I'm telling. I was like, come on, no, this has to be a joke. I know my wife is going to jump. I really thought they were just playing with me. He's like, I don't know how to say it, Mr. Williams, other than to tell you, you really do have kidney cancer. So we have to stop everything. So at that moment, I felt like, here we go again. My whole world is coming to an end. So what did I do? The only thing I knew to do was live. And so I just asked him a million questions. Okay, what do I do? What's next? The one question I asked was, what did I do to get this? He said, honestly, you didn't do anything. It's to just through the course of time and the various medications and how they impact your body. And I don't want anyone watching this to just label yourself as you're going to get just any number of things. He could not necessarily hook the train up. All he knew is this is the end result and this is what we need to do. So long story short, we worked through all that. I was okay. It was stage 1 of 4. We found it early. I had a nephrectomy, which is a fancy word for they just took the whole kidney out. Had to go through all of that, get back on the transplant list. Oh man, it was tough. So you really have to have a will. I hope I'm answering your question, Amanda, a will to want to live. So at the same time, I have this beautiful wife. I have 2 beautiful daughters. I pastor a church. I never quit my job doing that. So I'm impacting my community of faith. I never asked anyone in my church to give me a kidney. I just asked them to pray for me. I'm going to walk through this in real time. So some days I may not look so hot, and then I just asked some of them, if this is too much for your faith, please do not try and approach me with tears. I don't need that. I don't need pity. I don't need, oh my God, my friend had one and he passed away. That's him. That's them. I'm trying to live. And so Dr. Amro, I did everything I could to do everything I'm supposed to do. And so, yes, Amanda, I cannot put it into words. My living donor and I have developed a special code of how I say thanks. They were so altruistic, Dr. Amro. They were like, you never have to say anything to me about this again. That was just blew me away. I didn't know how to thank them other than thank you, other than I cried when I found out. I literally, like, man, this guy's crying a lot. Hey, man, medical issues will make you emotional. And by the way, I still see a therapist. because my life's not perfect. I have other things I'm dealing with. So I hope I'm not talking too much, but
No,
answering your questions.
you've answered them beautifully, and
Thank
and even beyond that. So I want to talk about something. I want to talk about the social deterrence of health and how communities of color, the environments are detrimental to health. So here we have Dr. Amro, who talks about, and I'll just use Pam as an example. Pam got totally checked out from A to Z, head to toe, making sure that Pam was healthy enough to do this. And she was, and she went ahead and donated her kidney. And yes, she is a queen, and so is your wife, for nursing you back to health. But I want to go back to perhaps the people in your church, or perhaps some of the people that you grew up with. Also, I want to touch on what Pam's father said. No, I don't want you doing that. Don't give a kidney. Right now, we are seeing vaccine hesitancy in communities of color, and they have every right to be hesitant, because why would they trust white people? We are not trustworthy. How did any of that play a part in you having to overcome that self-talk in order to say, I'm going to do this?
Is that for me, Amanda?
That's for you and also for Pam.
For me, Amanda, it's very simple. If I don't do it, I'm going to die. It was just that simple for me. How did I get to the vaccine? I have to. I mean, why be on dialysis? Why get a transplant? And there is this vaccine that can help you live a better life. And you don't have to be thinking in the back of your mind, when am I going to get it? Just go get the vaccine, and to be very frank with you, when I was on dialysis, I received vaccines. Dr. Amro, no, you have to get the hepatitis vaccine. I think that's 4. Is that 4 injections, Doctor? And they're
Yeah.
very painful, by the way. They go in the muscle and they go very slow. So, Dr. Amro, I will admit, I was hesitant due to that. I'm like, man, I mean, I've had needles in my arms for the past 20 years. I don't want any more needles. So I had to sit with that, and I didn't tell anyone, not my wife, I just sat with it in terms of there's the Tuskegee thing,
Yes.
there's the oh my goodness, there's the social ramifications of that. There are all these guys. I'm to all of my my brothers in the faith. Finally, I had to do what was best for LaMont. Ultimately, what's best for LaMont is what's best for my wife Felicia. What's best for her is what's best for my children, 19 and 17. What's best for the 4 of us is what's best for my community. What's best for my community is best for my county. What's best, I mean, I think you see where I'm going here, right? From county to state, from state to region, from region to country, from country to continent, from continent to the world. And so I had to think global, but act local. That's how I did it.
LaMont, you are a rare man of science and faith. I'm sitting here going, how did you make this tapestry work for you? Because I have been involved in families of faith that don't want people to receive kidney transplants and think it's a bad idea. And I've heard, as I've been in those families of faith, if you just pray hard enough, this won't happen to you. So I'm going to flip this now to our beautiful Pam, because Pam, everybody who knows Pam knows she is a woman of faith. She walks it on a daily basis. So Pam, how did you walk that line? I mean, here you have your dad saying, daughter, don't do this.
My dad also knows I'm pretty stubborn. So, he said what he had to say and I did what I had to do is basically how that boiled down. But I really think it's important to highlight the role that the social determinants of health play in this particular situation about kidney health, as well as overall health. And there are 5 social determinants of health. There's healthcare access and quality, there's education access and quality, social and community, the context of the society and the community you live in, economic stability, and then the neighborhood and your built environment. And the reason I bring those up is because I actually, again, went into being a donor without knowledge of the larger context of what it means for people in my communities and related communities of color being impacted by kidney disease. I really had no idea. And there was something that the surgeon who operated on me, who did the transplant, made a comment that I just found really, really intriguing. And it was that having that opportunity to have two people of color in the operating room at the same time, it was something that doesn't always happen. And I just, that just really struck me. And I had to sit and unpack that, and did that with a couple of friends. And I wondered, is this because in communities of color that this is taboo? And so where we landed was maybe at a certain generation, yeah, your grandparents say, I came in the world with these and I'm leaving out with them. But then when you get to our generations and lower generations, subsequent generations, is not so much an issue about it being taboo, but that people cannot be considered eligible to be a donor. As Dr. Amro said, there's this need and the supply is not matching the need. And so for me, it was, so why is that? And I began to realize, just in talking with people, generally every single one of those areas that I talked about in the social determinants of health, there's always this gap between the majority population, the white European populations, and all of the other populations of color. There's always this disproportionality. There's always this lag or a gap between education, between the social context, between your built environment. So typically the environments, the built environment, the communities that people of color and poor people live in tend to have less than. They don't have access to fresh foods. They don't have a grocery store, but they have plenty of fast food restaurants, and they have plenty of stores where they can go and buy alcohol. As a matter of fact, there's a disproportionality with billboards that are advertising these things in communities of color and low-income communities. And so what I began to realize, and also talking to a lot of people who are on dialysis right now, and they were young. They were young with diabetes, not the situation that LaMont talked about, but things that disproportionately show up in Black and Brown communities: diabetes, heart disease, obesity. And so for me, because I'm always curious, I always want to learn, I'm always asking, why is that? I just saw that this was really the first step in my journey. Being a donor really was the first step, because it has really become evident to me that there is educating that's needed in communities of color about taking care of yourself, getting checked out, and being able, if someone in your family needed a donor, that you could be considered because of your health. That if you're ruled out, it's not because you don't have the health criteria, but and there are other ways that you can be a donor without being a donor to someone in your family. I'll let Dr. Amro talk about how that works, where you can donate to someone in Wisconsin and they donate to somebody in Atlanta, and that donor comes back to Seattle. So anyway, I just wanted to really just highlight how the social determinants of health play a role in this.
Thank you, Pam, for that. So Dr. Amro, and this is also for you, LaMont, as our time is running short, but I want to ask this of both of you. What advice would you have for somebody who is listening and managing kidney disease? And I'll start with you first, Dr. Amro.
So the first advice, please, take care of your health. Take care of your health. That means you take care of your kidneys. So anything you do every day, every morning, look at your breakfast. Every noontime, look at your lunch. Look at your dinner. Look at your activity. What do I do today that's not good for my health? If you can change a simple thing every single day, that's important. If you take the elevator all the time, think about taking the stairs sometimes. If you use your processed food every morning, think about having more fresh food in the morning. If you have breakfast, Jimmy John's in the morning, McDonald's at lunch, and pizza at dinner, try to make some changes. So I think taking care of your kidney means taking care of your health. Taking care of your health means taking care of your kidneys. And the second thing is early detection. So if you are at risk, or even without a yearly visit with your doctor, if you are at risk, do more frequent, like Mr. Williams said. So I think this is important, just prevention, early detection, and I can't stress this enough. Before I give the stage to Mr. Williams, he mentioned that he wanted to thank the donor. I think you are thanking them every single day by taking care of your kidney, by taking care of your medication. This is the most important feeling for them, to see that their kidney is doing well. You are doing well. This is the thank you for them. And thank you for doing that. And thank you, Pamela, for doing what you did.
Yes, I think that's a living tribute, we call that, LaMont. So LaMont, what is your advice from somebody who has been there in the trenches to another person who maybe is going to have their first dialysis tomorrow?
I would say to them, as much as you can, to be mentally strong. You can do this. This is not a death sentence. You can make it through this. I would say educate yourself about your own body. Educate yourself about the things that can help you. I would also say to participate in your own healing. I was a little different in that I put the needles in my own arm, and because I really wanted to be in this thing. I would also say to anyone watching, like Dr. Amro said, I eat differently now. There are things I'd never ate before in my life. I changed a lot of I changed a lot of cultural things at the risk, and I have to say this, at the risk of some of my family members telling me I eat uh, I eat like a non-black person, whatever. There are more urban ways to say that I'll stay away from. But there's just some, I haven't had a soda in a long time. So I just had to stop drinking it. It wasn't healthy for me. I had to stop, some of these other things that are just not good. Dr. Amro talked about it. Fast food is not always healthy. And so you had to sit with a dietitian a few times. So I just had to educate myself. I work out 2, maybe 3 times a week. I'm not trying to be Mr. Olympian, but I'm not trying to be a sedentary person either. Walking is very good for you. I had to learn how to do that. So there's so many different things that I had to learn how to do because I want to live. I also had, Amanda, I had to just be willing to be selfish for my own betterment. In terms of people who are like, so, what are you doing and how are you doing? Well, how is that going? I mean, even now I take medicine twice a day still. There's still different medications you have to take. And I want to say that to people who are on the other side, keep going. Just because you get a transplant, you can't become lazy. You can't give up. You can't be like, I'm home free. You're not home free. I still see a nephrologist every 90 days. I still do blood work. There's still other things that I have to look out for, like diabetes, like high blood pressure, and they're going to impact your body. They're going to impact your mind. So many different things are going to happen, but you must keep going. So if I could end with anything, Amanda, to the person getting on dialysis tomorrow, you can do it. To the person on dialysis who doesn't even want a transplant, I understand that. You have the right to that. You can do it. To the person waiting on a transplant, you're like, man, LaMont, you were so lucky. I don't know. Just get on the list. Get on the list, play the odds. You can't get one if you're not on the list. I don't play the lottery, but someone once told me you can't win if you don't play. So you can't get a transplant if you don't get on the list. Stay in touch with your nephrologist. Learn from them. Ask them 1,000,001 questions. And for heaven's sake, stay off the internet. Don't let the internet educate you. Let people in the medical field educate you. And the last thing I'll say, no one taught me this, but I created my own support team. I took members from my family who I knew loved me, and Dr. Amro, they bring me case. I have 3 cases of water in my garage right now. I put a dorm room refrigerator in my bedroom with nothing but water in it. Why? Because I got to keep my kidney going. As you can see during this, I've been drinking water. I got to keep my kidney going. And so you got to kind of invest in your own health. And it was just people that I knew loved me. And I said, listen, guys, I need your help. And so to my men out there, don't be too arrogant. Ask for help. You can't get the help if you don't ask for it. So I can keep going, Amanda. But if you guys ever want to have me back, man, I'd love to help people. And I just want to break down racial barriers. I want to break down gender barriers. I want to break down those economical barriers. I want to break down all of those social barriers that if you want to live, you got to fight for this.
So that ties into my last question, and that is that we close out tonight's conversation like we do every week by asking everyone here, where are you finding hope? And I'm going to ask Pam to answer that first.
Here it is for me in a nutshell. I firmly believe this. Where there is life, there is hope. So I'm always looking for places where there is life. And I will, you're on mute, Amanda.
Wow, there we go. See, it happens to all of us. Dr. Amro, where are you finding hope this week?
I found hope today when I listened to the story from Mr. Williams and Pamela. I think this is what keeps us going. I always tell my trainee and my residents and my fellows, it is the patient you made a difference in their life that's what keeps us going. It just, we work very, very long hours, but when you see that you are able to make a difference in a single person, that makes your day, that makes your week. And tonight we are fortunate to have 2 people who really, made our week and made our month. It's the kidney month, and Mr. Williams and Pamela really made the month today.
I agree 100%. And LaMont, where are you finding hope?
Right now, Amanda, I'm finding hope in small things. Today, I just went for a drive by the water, and I just parked in a park and just listen to the waves. Just to be able to small things like being able to have a non-tense conversation with my 17-year-old daughter. If anyone has children, it can be tough sometimes. That is great. I'm finding hope also too in what I like to call the hidden figures. I don't know anything about what you all do, but Rob, you haven't said much. You're a hidden figure. I know you have something to do with this program. So thank you, Rob. I'm finding hope in you, Amanda. I don't know you personally, but you're a bright light. I mean, you're just a woman full of creativity and life and love. I'm finding hope in someone like Dr. Amro who's fighting for me, even though I don't know him personally. I know I have an ally. Of course, and then Pam with her revelation about being a donor, that is just, so that gives me more hope that if there's a man like me or a woman like me out there, someone's trying to help you in some way, some shape, form, or fashion, from a dialysis technician to a nurse to a dietitian to your nephrologist. And so for me, the hope comes from knowing that there is good in mankind.
Oh, whew, that last sentence just slayed me. There is good in mankind. Yeah, because kindness counts. It counts every second of the day. I want to say thank you to Dr. Amro and also, of course, you, LaMont Williams, for joining us tonight on Straight Talk. We want to encourage our folks to come back next week as Straight Talk is going to talk about back to school, as Rob said. For most Pierce County students, yes, the parents are cheering. And as always, you can find information about MDC's services on www.mdc-hope.org, and as well as links for upcoming Straight Talk conversations, as well as archives from those previous ones. As Pam said. And I want to say thank you so much to all of our panelists. And Pam, as I always say, you need to drive us home and tuck us in.
I just echo what Amanda said. Thank you so much to both LaMont and Dr. Amro for making the time and for helping to educate our community about the importance of kidney health. This March is Kidney Health Month, Kidney Health Awareness Month, because every month is Kidney Health Month. And we just thank you all, everyone, for joining. Always thank you, Rob and Amanda, for being here and helping make everything happen so flawlessly. To everyone who tuned in, whether you were a live participant or Facebook streaming, we just thank you again for joining us. We'll see you here at the same time next week. Good night, everybody.
Thank you.
Good night.
Bye-bye.
Bye.
Good night.